Josh Vance, the founder of Komizo Diagnostics. I'm excited to teach you how to use Komizo Diagnostics in clinical practice. The wonderful assessment tool that it is, but also the patient education part. So patients love this tool. We love to utilize it in practice, and I think you're going to find great value in its impact in your clinic. So the reason why we created Komizo Diagnostics is we wanted to be able to quickly reference and be able to educate our patients, and I wanted my staff to be able to have that education alongside me. So what's wonderful is they can see exactly what I'm thinking in my head, and the patient loves it, the fact that they can see their picture of pain on it. So I always thought it would be awesome if I could have my patients come in with their pain painted on them so that I know exactly what's causing their problem. So what this site is it allows us to be together on the same screen and for the patient to say, that's the closest thing to my pain. It allows me then to think through their condition a lot faster, but it also allows me to be very specific in my care. So we utilize therapies besides doing specific musculoskeletal work. But the cool part is that my staff knows what I'm thinking already ahead, because then I just tell them what muscle to work on. So they can access the site and they go exactly right to it. They're looking for the specific Komizo icon so they know exactly where to apply that therapy. So whatever therapy we use, whether that's using vibrational massage, a massage therapist, ultrasound, or e-stim, it allows our results to go up. Why that's awesome is that patients love to actually interact with our software. It makes me look like I know what I'm doing. I know that sounds kind of funny, but it makes me look professional. It also helps me educate them using pictures. So when patients leave the office, they say that in a patient encounter between a doctor and patient, they only remember 30% of what was said. Pictures speak volumes to that. They remember the pictures. They remember the reasons for what's causing their pain. And plus I give them a handout, so it's kind of like they're getting a refresher when they get home every time they look at that picture. It reminds them for why they're following up with care. The regions icon is like a map. All you have to do is have the patient select the area in which they're hurting, and then it'll highlight, it'll hover over that area, and then you select that region. Then the patient and you can go through on the same page, and you can actually look at specific muscles that have that referral pattern. These are pain pattern referrals, and the little icon we call the Komizo dot, that is the trigger point. All you have to do is confirm that with the patient and then select that, and it brings up our summary page. The summary page has all the information there to help you educate a patient, but also give specific things for you as a doctor to remind you of specific anatomy. This has been a wonderful tool for me because it helped me to review all the things that over the years that maybe I had kind of dusted under the carpet or didn't remember very easily. It's in there in real time for me, so I know specifics of those things. It allows me to see the anatomy to correlate that with the patient, which has helped me to review over the 20 years that I've been in practice. The Regions tab is actually the one the patients love the most. They get to select. People love to use technology, and now we're bringing technology into healthcare that's going to help the doctors and help the patients as opposed to only documenting. Also, I don't have to remember all the referral patterns. I don't have to remember all the exercises. This allows me to be proficient with it. It's exciting because then all I have to do is just pick the right area based upon what the patient has told me by their selection criteria, and then I have all the information and tools right there in front of me. What's awesome is that I can actually see my patient's pain. This is phenomenal for me. Now I can educate the patient about the specific exercises. I can go through them in real time, and that's a billable event. So if I educate, then I can instruct, and then I get to follow up and confirm that they're doing the exercises exactly correctly. If you bill for therapeutic exercises in your office, you're going to have the exact exercise in front of you and the patient at the same time to allow them to teach them how to stretch, and then you can confirm them as they do it from a screen. Very exciting for that. As a chiropractor, I look at this, and there is the nerve level that goes to that muscle group. So it's right there, so I can check these areas to find out if there's any irritation along that nerve bundle that could be causing that muscle issue. Now, below that is the action. That's exciting because here you can understand what action may seem to trigger that problem, and then below that is also the stretch that's exact for that muscle group. I also added a clinical correlation to understand a little bit more about what may be triggering that type of muscle issue, as well as the educational tool to tell the patient, don't do these certain things to help speed your recovery. There's also a link to Wikipedia if you want to learn more about that specific muscle group as a reference, and below that is a print icon. The print icon brings up the stretches that you would prescribe specifically for that muscle referral that they selected. They can take it home, put it on the refrigerator, then they're continually thinking about your office, they're thinking about their care, their part in the recovery of that, and also it's going to make them more committed to follow up with you. You can also utilize Komizo Diagnostics on a smart device or a tablet. Because of it being a web-based program, all you have to do is access our website, and then you have the ability to do the same thing that you would do on any type of computer. Brings up the same regions, areas, same tabs. It's very mobile friendly. When you touch any muscle group on the index, it'll actually take you right to the summary page, even on a mobile device. Still, if your mobile device is connected to a printer, you can do the same thing from there. The tab Muscle Index has all the muscles on our site listed, all in alphabetical order, which you can scroll through to find. If you know exactly which muscle that you're looking for, say for instance upon palpation, you notice that they have a knot or a trigger point in a certain area, a certain muscle group, you can go and find that through the list when you know the name of it. And by doing so, you select on it, it will bring up our summary page. The summary page is going to help us because it's going to have all the necessary anatomy right there with it. It's also going to have the nerve bundles if you're addressing nerves. It also has the stretches right there located with it. And again, it goes through, gives our clinical correlation to be able to explain a little bit about this one. For instance, with the sternocleidoid mastoid muscle, oftentimes gives ear pain and even sinus pain. That's all included in here. As well as the educational materials that are below to tell your patients or your clients what not to do, because that's instrumental in their care. So you're gonna cover all the bases. It's gonna really put you in an excellent light when it comes to giving excellent care to your patients. That's the whole reason for this resource, is to give patients the best care, to make doctors give the best care, and to connect them together using technology. At the bottom again is the icon, which you can give them a printable version of what it is to put on the refrigerator. This helps them to be reminded of why they're following up with you in your care, but also to give you better care in having them do stretches. They can actually take responsibility in some of the things that you're giving them and reminds them of why. The muscle index helps you quickly identify the specific muscle that you already know is a problem. The sclerotome allows you to explain to them about bone areas that cause pain, specifically such as facet joints in this picture. On the facet portion of this, you can actually explain to them, especially if they're having an injury such as a car accident, where that bone referral could be coming from, but also helps to give you one other area to look for besides only trigger point referral pain. The patient education tab allows you to tell your patients what to do and what not to do based upon using visual cues. So for instance, you can explain to a patient how not to sit at a computer and how not to use a smart device, because that's going to impact your care. Wouldn't it be great if you could get your patients to stop doing the things that they shouldn't do so that you can help them recover? That's what this section is about. It's also located on each individual muscle, as many of them apply, to be able to help be right there in front of you when you educate them about the specific muscle that we're dealing with. So you'll have these pictures as cues for them too. You'll see a little light bulb go on and you'll look like a rock star with that. We've went through and verified specific pain referrals for the majority of muscles that we see in clinical practice, which allows then the patient to be able to see exactly what is going on with them, what's the cause of their pain. Patients love that, but also it's very efficient. So there's no going through at different sites, pulling up different things on the internet to be able to show a patient exactly what's going on. It's all located there in real time. And every time a patient selects a certain area, they're committing to care. They're committing to their recovery, which that's one of the hardest things to overcome is how do I get the patient to commit to their care of understanding what's going on with them? How do I get them to stop doing certain things? How do I get them to follow up with their appointments with me? Komizo is a translator between the patient's pain and your clinical knowledge to give optimum results. Komizo allows you to give the best care you can but it also gives the patient the best care, and it connects the two of you together. If you have a patient or client that has numbness or tingling, you can also utilize the dermatome tab. The dermatome tab allows you to educate your patient or client of the sensation change, such as numbness or tingling, and you can actually show them based upon the upper and lower extremity where it comes from the nerve level of the spine. The disc level tab allows you to utilize outside films or MRIs to be able to go to a specific level of a disc, the nerve root that may be impinged upon. You can educate your patient as to why their pain patterns are coming from the area of the disc that's occluded, or the protrusion or herniation. It allows you then to specifically give rehab, especially if they had an impingement. You can educate them on specific muscles in which they need to tone or rehab based upon that weakness. Komizo helps me to understand my patient, to give the best care I can, and be very specific and proficient about our outcomes. The patient loves it. The patient is excited to be able to see their pain. They're excited about the handouts that I give them based upon therapeutic exercises, and allows them to be committed to their care, which gives me the best results. That's what I'm after. I want to give the best results, and I want to be proficient in what I'm doing with it. So will you. The organ tab, it's really that simple. Okay? If you wanted to see the actual referral pattern of an organ, we put that in our site also. So the organ tab allows you to triage through in your thinking, could it be coming from an organ or internal issue besides being a musculoskeletal complaint? So if you're wondering if it could be a potential gallbladder issue or a stomach issue and you don't remember which area is referred to based upon the organ itself, we put the tab in the site. The search icon at the top right of our site allows you to search almost anything on our site. So for instance, if you just select that little eyeglass at the top right and you type in, say, C6, which is a nerve root, it'll bring up all the muscles that actually are innervated by C6 through our site. And you can see different muscles, and all you have to do to go to the summary page is select the area and it'll bring it up specifically, so you can do just like educate from the anatomy. You can also get the stretches, same summary page as we've talked about previously. Also, you can search via action of muscles. So for instance, if you type in parentheses, shoulder abduction, it'll bring up the specific muscles that have to do with shoulder abduction. So you can narrow it in. Say your patient comes in and says, I can't do this certain action without pain. You have a quick way to reference that. For instance, Carissa had ear pain, so you could type in there ear pain in parentheses. It'll bring up all that cause ear pain. And the one that comes up specifically was one of those that actually she selected earlier. All of this is just by you picking what the search criteria is. You and the patient then can search anything on our site, be able to pull it up quickly and efficiently. This can bring the patient and the doctor on the same page, and it can be over just a simple word. Ear pain or sinus pain, you can search for that. It allows me to educate and verify them doing specific exercises in their recovery, which is also a billable event. Komizo gives the patient the ability to speak directly to your clinical knowledge. Komizo aids the practitioner in giving the optimum care based upon a selection criteria. Our website is komizodiagnostics.com, or you can also put in your search criteria pain.software. You can sign up under register on komizodiagnostics.com. Sign up with Komizo Diagnostics today and give your patients the best care. Thank you for your time. Komizo Diagnostics.